Welcome to Hey Gen Podcast. Today we're diving into the fascinating topic of tracheal stenosis. Ready to explore?
Absolutely. So, tracheal stenosis, it's when the trachea narrows, making it hard to breathe, right?
Yeah, exactly. It's like when a tunnel gets congested and traffic can't flow smoothly.
Right.
The airflow in the windpipe gets restricted.
And what causes that narrowing?
Well, it can be due to scar tissue or inflammation.
Mm-hmm.
Long-term intubation is one of the most common culprits.
Wait, so people who've been on ventilators are at risk?
Yeah, exactly. The tube can irritate the trachea over time.
Oh, I see.
But infections or autoimmune disorders can also cause it.
Interesting. So what about symptoms?
Well, people might experience difficulty breathing after simple activities like climbing stairs. There's
Right.
also stridor, that noisy breathing sound.
Stridor sounds like wheezing, doesn't it?
Yeah, sort of, but it's more high-pitched. It's like a whistle.
Okay.
Persistent cough and trouble clearing phlegm are also common.
And in kids, are the symptoms different?
Yeah, children might struggle with feeding or seem unusually tired after eating.
Right.
Their skin might even turn a bit blue due to lack of oxygen.
Oh, that's serious. So how is it diagnosed?
Doctors use endoscopic procedures like bronchoscopy to look inside the trachea.
Mm-hmm.
Imaging tests like CT scans are also helpful.
And what about treatment options?
There are several. Tracheal dilation stretches the trachea open.
Yeah.
Laser bronchoscopy removes scar tissue with a laser.
But do these treatments last? I mean, can stenosis come back?
Well, that's a good point. Sometimes it does recur because new scar tissue
I
can
see.
form. That's why follow-up is so important.
And surgery? Is that a permanent fix?
Tracheal resection and reconstruction can be more long-lasting since they remove the affected section. But it's
Right.
more invasive.
Makes sense. So, prevention? Can we avoid tracheal stenosis?
Well, minimizing prolonged intubation when possible helps.
Yeah,
But sometimes it's unavoidable in critical care.
true. Hey, but isn't it also important to monitor for early signs?
Absolutely. Early detection can make a huge difference in treatment outcomes. Regular
Exactly.
checkups are key, especially after intubation.
You know, it's surprising how something like scar tissue can impact breathing so much.
Yeah, it's kind of crazy. Our airways are delicate.
Right.
Even small changes can have big effects.
So if someone suspects they have symptoms, what should they do?
They should see a healthcare provider promptly.
Definitely.
Early evaluation leads to better management.
Well, this has been really enlightening.
Yeah, I'm glad we covered it. Raising
too.
awareness is so important.
Absolutely. Thanks for the deep dive into tracheal stenosis.
Anytime. Looking forward to our next chat.